My name is Landry Lively, and today we are going to be dissecting and looking into the pig's heart. And first we want to start with this outer surrounding the heart, the pericardium. And then right here we have the interventricular sulcus. Right here is the atrial appendage. This going into the heart is the aorta. Then we have the pulmonary artery right here. Then we have the pulmonary vein right in there. Then we have the superior vena cava right here. And then we're gonna go back to the front side, and this is the right atrium, the left atrium, the right ventricle, and then the left ventricle. And then now we're going to dig deeper into the heart. Okay, first, before we cut into the heart, we're going to cut off and remove some of this pericardium so we can see better into the underlining of the heart, anatomy of it. And we'll get some more. Now that we have removed some of this pericardium, we're able to see deeper or more of the anatomy, and there's this coronary artery. And now we are going to cut into the pulmonary artery, into the right atrium and right ventricle. Okay, now that that's cut, we're going to take a closer look. Okay, now that we cut it open, we are able to see we cut into the pulmonary artery, which then leads into the right ventricle, and that is connected to the right atrium by the tricuspid valve. And back here you can see the superior and the inferior vena cava feed blood into the right atrium. Okay, now we are going to cut the heart into two halves, the anterior and the posterior, as best as we can. Just take a little deeper look into it, in the middle of it. Now once we get this cut open, we'll open up the inside and take a look deeper into it. Okay, now that we have cut the heart into two halves, anterior and posterior, we have the trabecula carne, then we have the right atrium, the right ventricle, and then we have the left atrium, and then the left ventricle. Then we have the papillary muscles and the interventricular septum. Sorry, I'm not good with words, but it's very thick and it acts as a divider for the right and left ventricle. and then we have the aorta right here, and yeah. And thank you for letting me do this. Hi, my name is Landry Lively.